Welcome, everyone, to the La+Jolla+Cosmetic podcast. I'm your hostess, Monique Ramsey, and I wanted to talk to you today about something very special. March 8th is International Women's Day, and I think the whole month of March, we're celebrating women. And it's not just a hashtag, it's an organization that works on behalf of women around the world. So who knew, right? So we are surrounded by women here at La+Jolla+Cosmetic. Most of our patients are women. A lot of our staff are women. Our CEO, Marie Olison, is a woman. And our med spa CEO, Austin Schroeder, is a woman. And we have a mostly female workplace. And, 2 of our 6 plastic surgeons are women. And so I have Dr. Breister here with me today and wanted to welcome you, Dr. Breister.
Thank you. Nice to be here.
So before we start talking about International Women's Day, I wanted to just have you introduce yourself and tell us, maybe some of the women that you admire or you follow in either medicine or anywhere.
Well, I'm new to La Jolla Cosmetic Surgery Center, and I'm very happy to be here. It's been a nice introduction. I've been here about a month or so, and it's been very fun, and I've loved meeting all the people, and it's a great work environment. So I'm excited to be here amongst all the women that are here. That's number one. As far as women that I admire or follow, I love Michelle Obama. She's just one of my favorite women. She's just so strong, so unapologetically fierce in her own right. I admire that. Another one of my idols is the late Ruth Bader Ginsburg. I think she was just absolutely phenomenal in her career as an advocate of women and women's rights, and so those would probably be my 2 favorite women, I would have to say. But I follow all kinds of different actresses, models, educators, many different women I follow. So it's fun.
So talking about International Women's Day, one of their missions or part of their mission is empowering women's choices in health. And, I think aesthetic medicine really is all about empowerment. And have you, give me your thoughts on that. Like, have you seen how, plastic surgery or just medical aesthetics in general empowers women?
I have seen that. As women, we are all usually, we want to feel good about ourselves. I think that's the number one driver to us women. We just want to feel good in our own skin. So I see women, on the daily coming in and doing things for themselves that makes them feel better about themselves. So that's really the bottom line. I think that's what gives us the most power is self-confidence. And I think once women take that step, they actually give themselves the permission to take care of themselves. They're worth it. They're worth investing some money, some time, all the above. I think that in and of itself is very empowering. And then also with the changes that happen with plastic surgery or, treatments, they just start to feel better and better about themselves. And that's what I think gives us all the power, is just feeling good in our own skin.
That's so true. More and more women, I think, are becoming plastic surgeons. Nationally, 20% of plastic surgeons are female, and that's through the ASPS membership statistics, which is up from 12% in 2013. So in 10 years, that's a pretty significant change, and the trend is improving. But why do you think there's so many fewer female plastic surgeons in general?
Well, I think as a specialty, as a surgical subspecialty as a whole, it's a pretty rigorous training that you have to go through. So I think that as women, we oftentimes want to have children, or we oftentimes, bear the heavy lifting in the home front. So I think that can, drive some women away. They may just not be able or have the support to get through that kind of training. So I think that's probably mainly why that the women maybe in the past would gear towards specialties that didn't require quite so much, on call or time away from the home. But as hopefully in this country and everywhere else, childcare is more ready, available, and supported, and women are allowed to venture into some of the more time-consuming fields. But that's probably one of the biggest distractors, I think, or hindrances to women becoming surgeons is probably that time factor. And you have to do it pretty early in life, and kind of close to the childbearing years, and that can definitely be a conflict for a lot of women.
So tell me, how did you manage that? Because you have 3 children, am I right?
Yes, yes.
So tell us how how did you manage that?
So I went through my medical school and all of my training before I had any children. So the real commitments of spending, 36 hours in a hospital, not having sleep, working days upon end. Luckily, I didn't have children yet. I was very lucky to have planned that at the end of my training. So I had become an on-staff physician at the City of Hope, and the schedule at that point was a little more controllable. It wasn't quite as much on call. So I was lucky enough to time it. So I wanted to have a child right at that time when I started that job, and that's luckily I had one. And then from there on, I was also lucky enough to have, support, a really great nanny that could, live in my home and really help care for that baby. And without that, it would have been impossible, because that's the main thing. You want to feel very comfortable that your child is being loved and cared for. So I was lucky enough to have, support to manage that. A lot of women don't have that luxury, and how they get through it. They have a lot of family support and things like that. My family wasn't with me at that time; they were in another city. But luckily, I found really good care, and that's what enabled me to move forward and pursue my dreams of becoming a surgeon.
And, as plastic surgeons, do you feel that women face any challenges that their male counterparts don't?
Well, I certainly don't feel that I have. I mean, the biggest conflict is just, like I already mentioned, is, motherhood and being a surgeon. I think males largely are somehow a little bit lessened by that burden. They seem to have the luxury of, going to work and focusing on the work, where I think women somehow still have that in the back of their head, that they're still kind of, in charge, if you will. I'm sure that's not how every household works. But
right.
So I think that, largely that would be the biggest advantage I would think that a male has, is just, our societal norms have just always kind of, focused that the man's job is, that's their job. So they go do their job. Whereas the woman's job is a couple of things, it's not only the job, but it's also the PTA meetings, the soccer teams, the school uniforms, the doctor's appointments. Somehow that kind of usually gets a little bit, the woman has to deal with that. So that would be the only, I think problem that I ever encountered anyway.
So thinking about sort of medicine in general, do you think women in medicine tend to be taken as seriously as their male counterparts? Or, among, I guess it's kind of a 2-part question, with patients, do patients give you the same respect, or do you feel there's a different level of respect? And also among your peers I'm not trying to start World War III with my question, but, is there still, I guess, we've made a lot of strides for women's empowerment, but do you feel that there's still some issues, or do you feel as a female physician and surgeon that you know, have that same level of respect that your male counterparts do?
Yeah, I mean, I have luckily never really experienced a lot of issues with me being a female. I mean, as far as respect, I think that luckily in my generation, I mean, yeah, there are some, old boys club kind of things, but I think some of that stuff is, I've never taken on any of that too personally. So I think that, luckily I have not experienced a lot of that. And I think that the patients value my, everything I bring to the table is in medicine, which I feel is sometimes a little extra than some males. And I don't mean to generalize every male, but as a woman, a mother, I'm pretty empathic. I like to listen. I like to really understand what the woman is wanting. And I think that as women, we're kind of geared towards that. So I feel like patients respect and treat me just the same as any male. Like I said, because usually the ones that I'm seeing too are choosing a female. So they know somehow they feel a little more comfortable. They feel a little more maybe supported, heard, empathized with, or just more comfortable. Sometimes we're just a little shy or embarrassed. We don't really want to show our body or our flaws to a man, just 'cause it can be a little awkward. So luckily, I think on both fronts, I've been very respected and supported, which I think is great.
And hopefully, over time, I think that sort of idea of the old boys club, hopefully we're making progress. I feel like
it's fading. It's fading.
Yeah.
Yep.
Yeah. And I think, to me, as a woman who's been a mom and, we all have our own body insecurities, certainly, I'll flash any doctor to help me with my problem. But, am I going to feel as comfortable? I think being with a woman, you tend to feel more comfortable because you get it. You've had kids, you understand. And, so I think that part of it is for the patient can make you more relatable. So do you think that, and I don't know if this is, my next question kind of is talking about female surgeons or female doctors in general. I think there's a perception, and it happened with my OBGYN, and she's a woman, but she's very direct, very assertive, wasn't sort of the warm and fuzzy. And, do you think there's a double standard? If a man is that way, nobody questions it, that he's just direct and assertive and he's a man and he's not warm and fuzzy. And somehow is there an expectation that because you're a woman, you're going to be more empathetic, or you're going to be more, I don't know, warm and fuzzy than a man, and are you ever unfairly criticized for that?
Well, I certainly understand where you're going with that, and I think that there is an unfair bias that if a woman is a little more assertive or a little more direct, that can give her an unfavorable label or a stigma in a way, which I do think is unfair. But I think just as humanity, we all need to understand, women or men, we're all going to have different facets. So I wish that could fade away, and that women wouldn't get the bad names calling if they decide to be a little more firm or a little more assertive. So it's my hope that even as women, we all take everyone as an individual, whether it's a man or a woman. You're going to find very empathic men. You're going to find more direct men. Same thing with women. There's going to be all kinds. And I think if we're just all a little bit more accepting and open-minded, that, yeah, hey, there's a lot of different personalities, and just because it's a woman, it may not have been what I'm looking for, so that's the beauty of, being able to seek out a couple different opinions. There's going to be people that resonate with you, and sometimes it's not a woman, so I think it's nice that we all have that choice now, luckily there's more choices. There's more, okay, can I find a woman internist, or maybe I'm a little comfortable with an OBGYN, so luckily, hopefully the scales will get more 50-50 in all the surgical fields, and that way people can decide who's a best fit.
Yeah, that's true. It's really funny because my first OBGYN that I had after college, when not in the college medical system at USC. And so then I was looking back in the day through the phone book, and I see this name, and the first name was Robin. And I'm like, oh, perfect. A woman in Newport Beach. So I go through this
and you showed up, you're like, oh.
I go through this long onboarding questionnaire with the lady on the phone. We're on the phone for like 20 minutes. We go through the whole thing, and I said, oh, I'm really looking forward to meeting her. And she goes, oh, it's not her. It's
not her.
Oh. And I'm like, oh, okay. And then, but I had already spent so much time. I'm like, okay, fine. He was the nicest, sweetest man. I felt so comfortable. And especially, it's a very intimate appointment. And he was the best. So it was sort of like that preconception. And then my next OBGYN.
Yeah, it doesn't always hold up.
Yeah. And then when I moved to San Diego, I did see a woman, and she was very direct and assertive and not warm and fuzzy. And it was fine for me because I worked with female surgeons, and I'm like, okay, it's fine. She's a great doctor. But my best friend had gone to her and was like, she's just not very nice. And I'm like, well, she's nice, but she's just not. Yeah, she's just not that.
Doesn't resonate. Yeah.
Right. Exactly.
Feely, touchy-feely. We all look for things different. We all, like I said, certain things resonate, and that's why it's always good to see a couple of people, because you just never know how you're going to get that gut feeling that, okay, this is the right person for me, which I truly believe is a good thing to listen to.
Now, in your patient base, do you have men and women?
I do have men and women. I would say the majority is women, but there are more and more men that are seeking improvements in their body or their physique. And I think it's becoming a little more acceptable, and the stigma around that is starting to fade, which is great. So I'm very welcoming to men, and I have a lot of males in my practice.
Now, in your training, or in your time before you were in maybe private practice, did you have any stories of times where being a woman was either better or worse, let me say, than like, did you ever encounter any issues or obstacles that you had to overcome?
Well, I mean, in training, there's always people often mistake you for a nurse, or or they don't really know that you're the doctor. So there's a lot of that. Oh, I'm Dr. Breister. Oh, you're the doctor. Oh, I thought you were the nurse. I thought you were the, this or that. So there's a lot of that, but it's never really been a problem. I mean, I think people inherently are good. It's breaking through those societal, stereotypes that we are all used to. But luckily I didn't really encounter too much other issues with that.
Oh, that's good. That's good. So now we just want to, as far as getting to know you, let's talk about your path, and how did you end up in plastic surgery? And did you know that you always wanted to do aesthetic medicine, or kind of what did that look like for you?
Well, as a younger girl, I always was drawn to science, and I definitely had a curiosity about medicine. So that it became pretty clear to me early, probably middle school, that I really wanted to become a doctor. I liked the feeling of being in a hospital. I liked to know what was happening with people who were sick. Sometimes that scares people away. That somehow drew me in. I don't know why or how, but so luckily, I was always drawn to medicine, and I probably initially thought I would do dermatology, which I find pretty fascinating. However, once I was in medical school and you do rotations in the various disciplines, once in the operating room, it was just like where I needed to be. It just felt like home to me. So it became quickly apparent that I wanted to be a surgeon. So in that, there's a little bit of, you rotate through a lot of different surgical disciplines, and they all have their pluses and minuses. And I discovered plastic surgery, which was just really refreshing because number one, the patients for the most part are very healthy, and it's not quite as stressful as a trauma surgeon or an orthopedic surgeon people have a lot of medical issues, and those can be kind of stressful. So I found that the practice of plastic surgery was a lot of really happy patients who were doing things to improve themselves and had very good outcomes. So I was definitely drawn to aesthetics. I have a really aesthetic eye, so I could see things that, what would help the patients. I felt like that was a talent. And then I also loved the variety that aesthetic surgery has. There's a lot of different types of procedures you do, or I do. So that that drew me in.
Now, tell me, do you have a favorite procedure that you do?
Well, I have to say I really love all the procedures I do. I enjoy, the intricacy of a facelift or an eyelid lift. It's very precise and very meticulous. But I also really love the types of surgeries where I'm taking off a lot of skin in, say, like a weight loss patient. They have, pounds of extra skin to remove, and those are equally fun, exciting cases. There's such a dramatic difference when you can help someone like that. So I really love it all. And that's, I can't really say, I love one more than the other. It's more like apples and oranges. They all are different in their own unique way. So I really just love surgery in general. It's very empowering, if you will. It's very fun to walk into an operating room, and when you walk out a couple hours later, they've been transformed, and it feels good.
I bet you're making such an incredibly positive difference in someone's life. That's gonna stay with
fun.
them forever.
Exactly.
Now, do you have, when you get up in the morning, do you have like a certain inspiration, or like what inspires you as you go to work?
I think the biggest inspiration is the patients after their surgeries who are so grateful and happy, and they basically, come in with an extra pep in their step. It's a really great inspirational feeling to be able to make a difference in someone's life like that. And it doesn't necessarily, the woman can have had a procedure that no one really can see or know about, but the fact that they now sit more comfortably in their own skin creates a very like a pep in their step, and a confidence that is really it's really nice to see. So that would probably be my biggest inspiration.
That's wonderful. Now, do you have anything that you want to share about what you like to do when you're not at work?
Well, I love being outdoors. I love, born and raised in California. I love being out in the sun, out, so I love to, run or go for a bike ride or ski. Pretty physical. So I love to do things that, just are pretty athletic. Those are my favorite things to do, and preferably outside if the weather's good. So that's kind of me in a nutshell.
Well, it's a good thing you live in San Diego, and you were born and raised in San Diego.
I was, yeah.
Yeah. So
born at Sharp Hospital.
That's
where I'm
wonderful.
home.
I love
Feels
that.
like
I
home.
love that. Yeah, there's a few of us now, and it's actually been really fun throughout the podcast to as I interview people and meet them. I'm like, oh, you were born at Scripps? I was born at Scripps, and everybody's we have quite a few San Diego natives on the team, which is really fun.
Yeah.
Yeah.
It's a nice place to be
Yeah,
from.
it is a nice place. Well, I think that we got through all the questions. Do you have any other things sort of to share about Women's Month, the International Women's Month?
Well, not really. I mean, I just think that I think it's nice that we're taking a moment to kind of appreciate women. I think that, women sometimes don't get quite as much appreciation as needed. So I think anything that we can do to help boost each other up, I think is great. And I love to see women supporting women. I think that's very powerful when we can all stick together.
Yeah. Yeah, I do too. I love that. Well, thanks for coming on the podcast today. And we
You're
will
welcome.
hopefully
Thank
be
you.
able to break into your schedule again soon. I know you're really, really busy,
Yeah.
but I do want to do a Meet the Doctor episode where we can dive more
Absolutely.
into some of the things we touched on today.
Great. Well, thank you so much.
Thank
Talk
you.
again soon.
Take a screenshot of this podcast episode with your phone and show it at your consultation or appointment, or mention the promo code podcast to receive $25 off any service or product of $50 or more at La Jolla Cosmetic. La Jolla Cosmetic is located just off the I-5 San Diego Freeway in the Zymed building on the Scripps Memorial Hospital campus. To learn more, go to ljcsc.com or follow the team on Instagram at ljcsc. The La Jolla Cosmetic Podcast is a production of The Axis, TheAxis.io.